Hi, this is a nursing professor here. We want to talk today about homeostasis and the body's attempt to always maintain some sort of balance. And so when one thing goes wrong, then it has this trickle-down effect of other things going wrong. And when we talk about the balance as it relates to homeostasis, then it really can be related to whether or not a person lives or their state of wellness. So an example of that would be body temperature. We know normal body temperature is about 37 degrees Celsius, 98.6, right? But any of those extremes, like for an adult, if the body temperature is above 103 or less than 95, sustained for any length of time, then we have trouble that could possibly influence that person's life. So there are other variables that we would have to consider. Okay, so if somebody came into the emergency room, they had this body temperature of say 93 degrees, then we'd have to look at the variables there as well. Like, what was the environment like? Were they outside in the cold? Did they have on clothes or proper attire? Was there any shelter? If they have a problem with their hormones or some sort of disease process, or maybe even a brain injury where the hypothalamus is not working as it normally would, or some sort of alteration in their metabolic rate that their body's not able to rev up in order to create the increased temperature that it needs in order to sustain itself. So remember that the body's always seeking homeostasis. So a couple of the factors that influence that. Let's start talking about acid-base balance, okay? Which means this is the body is still using that same concept of homeostasis, and it has an endpoint that we look at, which is normally around 7.35 to 7.45. That's what we consider as a normal pH. 7.35 to 7.45. If it is below 7.35, then we consider that the body is in an acidotic state, or it's too much acid. If it is above 7.45, we say the body is in an alkalinic state, or it has too much alkaline. And so the number you always need to remember before you can calculate anything about an ABG or an acidotic or alkalotic state is to know the 7.35 to 7.45. So what's an acid? So an acid is a compound that has the hydrogen ion. So this is where we go way back to when we took chemistry. We try to figure out what the heck do we need to know chemistry for? Well, if you remember, the hydrogen ion had a positive charge to it. And so with that, it could attract other things to it, all right? So if the body has too much of that, that's a problem. And so sometimes we will see that with GI discomfort, like if somebody has increased gastric secretions. Can you imagine what the outcome of that is? It's too acidic. Many times it starts to erode the lining of the stomach. And so when you think about that concept, it can help you understand what we're talking about, because this can't be about memorization. I'm gonna tell you, you're never going to be able to answer those questions if you're only memorizing values. All right, when we talk about basic or alkaline, then again, greater than 7.45, and this is a compound that accepts that hydrogen ion. So it's usually negative, and it's going to take or attract the hydrogen ion. And so when our bodies are in its happy state, then that equilibrium does exist, which is the same thing we were talking about when we talked about homeostasis. Let's see what's next. So there are a few mechanisms that work to maintain this acid-base balance, and it is buffers. Now, these buffers prevent the body from having these huge swings in the pH. So I'm going to say this again, 7.35 to 7.45. So the buffers prevent that from going to either extreme by producing these weak acid and weak base, and such that it can start to attract that when the body is leading towards this acidotic state or alkalinic state. The other two components that, or mechanisms that we look at when it comes to maintaining acid-base balance is the respiratory control of carbon dioxide, If you remember in our respiratory video, we talked about how respiratory is really the exchange of gases. So here we are back to that. That's why you can never forget anything. Because if you are not able to control your carbon dioxide or CO2, then you can get increased volume of CO2, which could be very dangerous to your body. The other organ associated with it would be kidneys. Kidneys kind of regulate a little slower though than the respiratory system, but the kidneys do regulate bicarb or HCO3. All right, so the body's always seeking, again, balance. So sometimes our fluids are imbalanced, meaning our extracellular fluids or our intracellular fluids. So these are all the fluids that are involved with our cells, and they go in and out of the membranes of the cells. So intracellular is, of course, inside the cell, whereas extracellular is outside of the cell. Okay, so remember that. These fluids do move and then go back to chemistry. They move by osmosis and diffusion and filtration and active transport. Remember that? So these components help, again, to maintain the body's homeostatic state. All right, so there's this exchange of intra and extracellular fluids that in its normal state works fine, works wonderful. You don't know it, and the body does well. But there are times when we get ill that those get out of sync, and that shows up in our blood work, and we have to address that. All right, so two of the most important problems as a nurse we have to look at would be fluid volume deficit. And it's very much what it says. It's a deficit, meaning that there's not enough fluid. And so with that, we would start to look, of course, as to why this person doesn't have enough fluid in their bodies. And that could be from many different things, but in particular, dehydration. The body can lose water fluid without losing the electrolytes. So that would be considered dehydration. When the body loses both water and electrolytes, it's called isotonic fluid volume deficit. Okay, so two states. Dehydration is when the body loses water and not the electrolytes. And isotonic fluid volume deficit is when the body loses both water and electrolytes. Okay, and so in isotonic fluid volume deficit, then you have this hypovolemic state. You know, there's not enough fluid there as a result of that. And of course, those electrolytes would need to be replaced. Versus dehydration, you don't have enough fluid, and so many times what you will see is your labs will become very concentrated, in particular like your hematocrit. If you were to look at someone's hematocrit, then many times it's so concentrated because the cell doesn't have enough fluid, and so it makes the volume go up, and so that value is not accurate because the body doesn't have enough fluid. You also can see it in urine specific gravity as well. That's also a good indicator if a person is dehydrated. Now, fluid volume deficit, where you're losing both water and electrolytes, it can lead to shock, hypovolemic shock, because you've lost so much. And so it's very important that that is treated right away. So speaking of deficits, then we lose extra fluid many times by urine. And so what is the minimum amount of urine that you should have per hour? That answer is 30 milliliters. So if your patient is not producing 30 milliliters of urine, then you have a problem there, and that should be reported, because that could be for a host of reasons. Just wanted to throw that in there because sometimes it's not really highlighted. All right. And so factors that could affect also this fluid volume deficit could be age. The older you get, then the decreased likelihood that you're able to control whether or not you become dehydrated or not. You're more apt to become dehydrated if you're not taking in enough fluids, especially when it's hot outside. And so you will see, especially in long-term care facilities, that you're encouraged to make sure you're giving a resident something to drink every hour, because many times the older we get, we don't have that same thirst mechanism, and so we have to make sure that older people have enough fluid. The same is true with babies. So at either end of the continuum, the young person like a baby and old person like elderly people, we have to be very careful with them because age is definitely a factor there. So how else can this happen other than the component of age? Think about if a person has vomiting or diarrhea. You're losing a lot of fluids like that, especially if you have them coming out both ends. You know, recent in the news, we heard about Oprah and Gail gave the tea that she had it out of both ends. So she was at risk and apparently did have dehydration for whatever reason there. Skin loss, like you can sweat profusely, and if you're not taking in enough fluids, then you could end up in dehydration. The renal system. You know, think about all the diuretics that your patient might be taking, especially to control their blood pressure. If they're taking a lot of diuretics or maybe the incorrect dose, they can end up with a deficit there. Diabetes insipidus, you drink, and PPP can end up with dehydration. Kidney disease, we already talked about the importance of renal and adrenal insufficiency. So all of those are possible ways that could influence that a person is dehydrated. Also, third spacing. Now, what's third spacing? Think about when you have a collection of fluid outside of the actual cell. So you see that many times with burns or a person who has ascites. Ascites is when a person doesn't have their liver isn't working properly, and so they get this collection of fluid build up in their abdomen. Or they could have an intestinal obstruction, which is a frequent complication of surgery, because with surgery everything slows down, and sometimes people have an obstruction after surgery, and so that excessive loss of fluids can result in dehydration. And also really bad wounds. So make sure that you're considering that if you have a person with like a stage 4 wound that's really has a lot of drainage, because many times we don't look at that as something that is being excreted from the body, but in actuality it is. And of course, hemorrhage, you know, that goes without saying that that person will end up with a fluid volume deficit. And sometimes we can lead to this when a person has altered intake. You know, how frequent do we make a person NPO, nothing by mouth, say to prepare for a procedure, and the procedure keeps getting pushed back further and further. They were supposed to go at 12 noon, and before you know it, it's not till 10 o'clock because something happened with the OR scheduling, or the person was nauseous, couldn't drink, or the person had impaired swallowing, especially after a stroke. And so we need to make sure that we're looking at those things when we're looking at these deficits that can occur. What you will see if a person has any of these conditions is an alteration in vital signs, of course. A person could be hypothermia, meaning that their temperature could be low. They might have tachycardia, meaning their heart rate is high. They could have a thready pulse, which means that the pulse is not regular. It's almost like it almost like runs. You have to feel it to really understand that. Hypotension, because they've lost so much fluid, then the blood pressure is lower. Tachypnea, we talked about the importance of respiratory in trying to seek homeostasis, and so this person might breathe faster in order to get more oxygen in and hopefully push more carbon dioxide out. And you'll also see it with the pulse ox that you might take, that this person might appear hypoxic or have a lower O2 saturation, which is typically lower than 95%, which will show that they really do need oxygen replacement. In the neuromuscular system, the person might complain of dizziness, feeling like they're going to faint. When we talk about fainting, the word we use is syncope for that. Confusion, weakness, fatigue. And so those are symptoms of hypovolemia or dehydration for a person that is experiencing that. The GI system might show up as this person is really, really thirsty. Their skin is dry, especially their tongue. Their tongue might appear to have like a white coat on it, or really furry, because that could be a sign that is resulting from either excessive nausea and vomiting or anorexia, where they're unable to eat, and acute weight loss, especially if it's too fast, can result in that. In the renal system, we might see oliguria, which means that the person is not producing enough urine. And so go back and think about the minimum amount of urine that a person should produce per hour is 30 mLs. And so if it's less than that, then we know, again, that we have a problem. On the skin, it might be dry, itchy. You remember the skin turgor that we test for when we were talking about the integumentary system. You know, a way of assessing that, again, is the back of the hand. You squeeze the thin part of the skin here, the epidermis, remember that? And so it should pop right back. But in a person that is experiencing dehydration, then it's going to remain tenting. All right, and so how do we assess this? So we assess it based upon the symptoms, of course, that the person reports. We're going to look at labs, in particular, things like the hematocrit or serum osmolarity, the urine-specific gravity, and the sodium level, because sodium is frequently lost when a person suffers from dehydration. We're also going to get their vital signs, because remember, we're going to see alterations in that. The heart rate will go up, respirations will go up, pulse, I already said heart rate, right? Blood pressure will actually go down because you don't have the volume. Neurostatus, person might have some confusion, and if it's really bad, they will actually lose consciousness. Then we'd move to the nursing diagnosis, which could be alteration in fluid volume deficit, or risk for impaired mobility, because if this person is so weak they can't move around, then they're going to need some assistance. Impaired level of consciousness could be another one. Again, if it's so severe, then they might not be alert and oriented. And of course, always risk for falls, because that person has had this change in their system balance, homeostasis, and so those people are at risk for falls. Our interventions would include monitoring intake and output, measuring what they take in, how much urine is actually coming out, their labs, make sure they have IV access. Even if IV fluids are not ordered, they should have IV access. Frequently assessing their level of consciousness for change. Instruct the patient to change position slowly, because if they are hypotensive and they go to pop up, then they're going to faint. All right, and make sure you're preventing skin breakdown, because we've already said that they might have some mobility problems. So let's look at the opposite of that real quick. So that was dehydration. That was not having enough fluid. So let's look at fluid volume excess. And this we know as hypervolemia, too much fluid, where the person is retaining water and typically sodium. The person could be overhydrated. You know, you hear these horror stories of people who drink all this water thinking water is so great for them, which it is. But if you drink more than the body can handle, then it's not going to be so good for you. So in overhydration, you have the body retaining more water than electrolytes. And then, of course, that imbalance does happen. When you have this excess fluid, it can result in pulmonary edema and even heart failure, because remember, the heart is a pump, and if it's unable to get rid of the excess fluid, then those things can happen. So with our assessment, again, using the nursing process, we're going to assess the person, of course, level of consciousness, their vital signs. In excess fluid volume, we typically see the heart rate up as well. A bounding pulse, like you could barely touch the pulse and you feel it. Hypertension, the blood pressure is up because it's excess fluid that the heart's trying to pump around, and a person can be tachypnic because the excess fluid again is causing trouble with their lungs, and so their lungs are having more resistance in order to breathe. All right, then we come to our nursing diagnosis, right? So it could be fluid volume excess or risk for skin breakdown, because when a person has this excess fluid, especially like in their lower extremities, then the skin can literally break open as a result of that. And some people do experience chronic leg ulcers as a result of that. Our plan, of course, would be based on whatever the symptoms that we see. Like if a person had bilateral lower edema, then we want to make sure that our plan would include that, X amount of edema will be less in 48 hours, something like that. Our interventions would be to look at the labs, in particular the serum osmolarity, sodium, hematocrit, get a chest x-ray to make sure there's no pulmonary congestion, look at the electrolytes, do an ABG, which is an arterial blood gas, monitor for shortness of breath, listen to the lung sounds. If you have excess fluid, you're going to hear that crackle, and we talked about that in our respiratory video, but crackles sound like fine hairs. Like if you would take your hair and just kind of move it together, it feels like that. Or the breath sounds could be really diminished because it's so much fluid that is kind of obscuring you from being able to hear. Also be careful with any person with respiratory problems, or in this case fluid volume excess, that you sit them up. It is hard to breathe when you have respiratory problems and you're laying on your back. And remember, laying on your back is supine. Coming up somewhat is semi-Fowlers, but you want that person to be comfortable, and sometimes that means putting them in either semi-Fowlers or high Fowlers in order for them to be able to expand their lungs. You want to get daily weights, because that will be a good way of tracking whether or not they're getting rid of some of that fluid. Intake and output, we've said that already. Medications are usually diuretics. Those are medications that helps a person eliminate the excess fluid through their urine. You want to support the arms and legs, or whatever body part that is has edema. You want to try to lift it above the heart, because that can help with circulating the blood flow back to the heart because of all this excess fluid. So I got a question for you. The nurse planning care for a patient who has dehydration. Okay, remember dehydration, not enough fluid. In which of the following actions should the nurse include? So of which of the following actions should the nurse include? A, administer antihypertensive medications on schedule. B, check the client's weight each morning. C, notify provider of urine output if it is greater than 30 milliliters per hour. Or D, encourage independent ambulation 4 times a day. So those are your choices. The answer is only one. Put your answers in the comment section below. We will tell you whether or not you're right or wrong. So, bye for now.